more and more people, they are participating in sports, running, marathon. So the incidence of running injuries or the sports injuries are increasing. Now majority of the injury we see above the knee joint and about very few around the ankle. And usually if you are a new person who have started doing running, you are more prone to have injury. Now the most common knee injury is around the patellofemoral joint, say joint between your kneecap and your lower end of your thigh bone, then the ligament around the knee or the meniscus. They are like cartilage are there in between the thigh and the leg bone. The first thing is you need to know your limit. Don't force yourself or try to follow the other. You should know your limit. Do a lot of stretching before and after the running. You should have a good running shoes which are comfortable, which give adequate support in the midfoot and all around. When you are running, try to run around 2 to 5 times a week. If you run more than 6 times a week, it's not safe. Running only once in a week is also not safe. The speed of running should be equal or less than 8. Don't try to increase the intensity of the running like tremendously. There should not be more than 10% increase. If you have any knee injury, then usually you have pain, swelling, stiffness. So what you should do, you should give rest. You should follow the RISE, which is the rest, ice, support and the elevation. Try to take some simple painkiller. If the pain is still there, you should see an orthopedic surgeon, and based on clinical finding, they advise treatment, and usually it's in the form of conservative. If the pain is still there and extending more than like few days or 6 days or clinically it's very bad, then we go for X-ray and MRI, and then based on the finding we decide the treatment. If there is a ligament injury like ACL or PCL, then we try to avoid the surgery during first 7 to 10 days. After that we again evaluate clinically. If there is a lot of instability is there, ACL is totally gone, then we go for ACL reconstruction. There are various options are there for hamstring and the patellar tendon. For young patient we go for patellar tendon, and in other patient we go for hamstring graft, which is fixed by making hole in your leg bone and the thigh bone with either the metallic screw or the bioabsorbable screw. You are in brace for 6 weeks, and after that gradually you need physiotherapy and the strengthening.